Penn Highlands Healthcare, offering robotic-assisted knee and hip replacements. This is Mako.
Hello, my name is Dr. Matthew Varacallo, and I'm the Director of Orthopedic Robotic Surgery here at Penn Highlands Healthcare. Just want to have a discussion today about preoperative, so before a surgery, decreasing your risk factors for having an issue after a joint replacement. So the purpose of this video is really for patient knowledge and patient education and patient awareness as to how you can decrease your risk factors for having a bad outcome after a joint replacement. Or the other way to look at it is improving your odds of having an excellent outcome after a joint replacement. So the first one that I always talk to my patients about is weight loss. So if you're a patient of mine or you're a future patient of mine and you already have an ideal weight and you're in excellent shape, that's perfect. You can fast forward this video. But other patients, actually the majority of my patients that I see, need to do some sort of weight loss optimization prior to surgery. So I want to talk to you about a couple of those things. The first one is your body mass index. Now, what is the BMI? That is a ratio, and it's a measurement and a calculation of your height and weight. So if you actually go on to Google and you put calculate my BMI, you could see multiple things pop up there. And this is a simple way that you can calculate it. So what I'm looking at here, and there's various degrees of your BMI and categorizations for it, but the number that I like to hone in on is 40. So if your number is higher than 40, you're at an increased risk of complications after a joint replacement. So what could a complication be? A complication could be continued pain or stiffness after the joint replacement, infection, which is the one that I really worry about, dislocations, such as for a total hip replacement, having a hip dislocation afterwards, and also having a fracture around the implant that involves the bone. So all the studies have shown in the literature that if your BMI is higher than 35 to 40, compared to somebody who's below that level, so in the ideal weight range, so for example, 18 to 29 or 29 to 35, you're at an increased risk of these complications. So a lot of times I see some patients who have been to other surgeons where the surgeon will come in, quite frankly, it's a very curt discussion where they say, you're too overweight, you need to lose weight, I won't do your joint replacement. So I want to go into a little more detail in terms of why, that's probably not the best way to approach it. So when you come to my office or see one of my colleagues, our approach is really that if your BMI is a 45 and you come in, the reality is you're going to be waiting probably a couple months before your joint replacement. So it's important to utilize that time frame to get into a weight loss program. We can actually help refer you to that program as well. Or I see a lot of patients that are already involved in one. So if you come in and let's use 45 as an example for your BMI, I want to know, is that trending downward? Say your BMI was 50 a month prior, and if it's 45, that's excellent. Or the other way, on the flip side, is if you were a 39 and you go up to a 45. That's something I get a little concerned about because if you're putting on weight before the surgery, it's important to optimize that weight level because it's going to decrease your risk of complications afterwards. The other thing I always get asked by patients is that, how long does a total joint replacement last? Well, if you're overweight, the longevity of the components, because there's more stress and force that goes across those implants, the more force that goes across there, they wear out quicker. So that's the other side of it in terms of weight loss. And so thankfully at Penn Highlands here, we have a weight loss program, and we have a nice referral program where in those couple months before surgery, you can decrease or you can optimize your weight loss plan. And it doesn't have to be anything fancy. It can be just simple diet and exercise and like adjusting the times that you eat during the day or adjusting the foods that you eat. So it's important to have that discussion. That's why I'm having that discussion with you, because I have it multiple times during my clinic. And then the other thing I look at is, and I see patients that struggle to lose weight because the joint is very arthritic and you have a ton of pain. I completely get that. So one of the things I look at is if your BMI is 45, then we say in that 2 months you get it to 44, 43, 42, maybe you're struggling to get it to under 40. But what I like to see in that situation is the trend that it's downward. So that tells me that your mental attitude, you are ready for the joint replacement and you are ready mentally to take on this new phase in your life. So that's something I look at, because patients' mental attitude and their preparation going into surgery is by some standards, and I think the number one factor that determines how you do after a joint replacement. So that's the weight loss part of it. And obviously I'd be happy to discuss further details and questions with you in my office as well. Number two is tobacco use. So this area especially, I see a lot of heavy tobacco users, whether it's smoking, vaping, cigarette, cigar use, chewing tobacco. All of the studies show that patients that are current tobacco users compared to patients that aren't current tobacco users or never tobacco users, there's a 3 to 4-fold increased risk of infection. So again, another thing I always say to my patients is that if you have a bone-on-bone joint, I get it, that's extremely painful, but the one thing that is going to be worse for you is if you have a joint replacement and that joint replacement gets infected. So anytime you have a surgery, you can think of it this way, you're rolling the dice with odds of an infection. So when you put a total joint in, if that joint gets infected, that can be as serious as something that, unfortunately, people can die from. So that's why I draw a hard line in the sand with that when patients come in, and I've seen people that they smoke 2 to 3 packs per day. It may seem crazy, and they've been doing that since they were 6 or 8 years old, believe it or not. I've seen it all. My plan is that you undergo 4 weeks where you stop the smoking, and then we can do the joint replacement. There's this large study, thousands and thousands of joints, where they showed that current tobacco users, if they stop for 4 to 6 weeks before the surgery, their risk comes down. It never gets as low as somebody who doesn't smoke, but it comes down to very close to that level. So in my mind, all of these, I call it risk factor mitigation. So everything that you're looking for before a total joint replacement is trying to bring that risk for a complication down as close to 0.00% as we can get it. That's my job as your surgeon, and our clinical support staff and team, we help guide you through that process. The one I want to highlight here, because I see a lot of snuff users, is the Smoky Mountain Herbal product. And I'm not a consultant for this, I'm not endorsing it, but they sell it at Sheetz and they sell it at other local stores. I have had people who have been chewers since they were 6.5 to 7 years old, and they have used this and transitioned away from snuff, traditional snuff, and utilized this product. And every single patient has told me that, number one, they saved money and they had more money in their pocket at the end of the week, which is, number one, that's great, on top of the health effects as well, the health benefits. And number two was that they realized that whether it was they were chewing gum or chewing this alternative, that they found that they really weren't addicted. And a lot of it is a psychological component to it. But I promise you, if you undergo this tobacco cessation, you do that work ahead of time, it will help your recovery after surgery. The other one I want to touch on is diabetes. So I see a lot of diabetics. It's important to work with your primary care provider, or if you have another specialist that you're working with, to bring your A1C down to below 7.5. Again, all the studies in the literature showing that if your A1C is above 7.5 compared to those that are below 7.5, the increased risk of infection is pretty dramatic in those patients getting a joint replacement. So again, I get a lot of patients who say, "Doc, my A1C is 11.5 and it's never been that low. It's never been down to 7.5. The reality is a lot of times you can get there. A lot of times it can be with diet. It can be with basic medications, but there are a lot of different medications that are coming out. So it's important to have that discussion with me or one of my PAs or another one of my orthopedic colleagues in the office about how we can get you set up with your primary doctor or another specialist and get your diabetes under control. Again, so those are major risk factors that I wanted to touch on, and they're very important, and I consider all of this in the prehab phase prior to a joint replacement. So if you're waiting that 2 months, we make sure we decrease your risk factors as much as possible. So thank you for your attention.